Hi friends! Today we'll talk about cat kidney sickness. This is very important for all cat owners. Cat kidney sickness is like a sneaky thief. It hides for a very long time. Your cat looks happy and healthy, but inside the kidneys are getting sick. You might not know until it's too late. This sickness happens to many cats. Half of all cats get this problem. If your cat is very old, like 15 years old, almost all cats this age can get sick kidneys. This is very scary. What is kidney sickness? Think of kidneys like a filter in your house. A filter cleans dirty water and makes it clean. Cat kidneys do the same thing. They clean the cat's blood. They take out all the bad stuff. Then the bad stuff goes out when the cat pees. But when kidneys get sick, they can't clean the blood anymore. All the bad stuff stays inside the cat's body. This makes the whole cat sick, not just the kidneys. The worst part? The cat looks fine for a very long time. You think your cat is healthy. Then one day, your cat gets very sick very fast. By then, the kidneys are already very sick. At the beginning, only a special doctor test can find the problem. You can't make sick kidneys all better, but if you find it early, you can help your cat feel good for many more years. Cats came from desert animals long ago. Desert animals don't have much water, so cat bodies are very good at saving water. They don't need to drink as much as dogs. Their pee is very thick because they save every drop of water. This is usually good, but it can also be bad. When cats don't drink enough water, their kidneys work too hard. When you work too hard for too long, you get tired and sick. The same thing happens to cat kidneys. Not having enough water is the biggest enemy of cat kidneys. Wild cats get water from the animals they catch and eat. The meat has lots of water, about 70%. But dry cat food has almost no water, only 6% to 8%. Cats can't just drink more water to make up for this. Their bodies don't work that way. Even if you put a water bowl next to your cat, it doesn't mean your cat drinks enough. Many cats only take a few tiny sips each day. This is not enough. Every cat needs a certain amount of water each day, just like people do. A cat needs about 2 cups of water for every 10 pounds it weighs. This includes water from drinking and water from food. A cat that eats dry food needs to drink much more water than a cat that eats wet food. But even wet food can't replace a water bowl. You must always have fresh water for your cat. Many cats don't like still water in a bowl, but they get excited when they see water coming from the sink. Some cats like their water bowl in a different room, not next to their food. The best thing is a water fountain. Moving water tells the cat the water is safe to drink. Fountains can turn cats that hate drinking into cats that love water. Another big enemy of cat kidneys is bad food. Cats are hunters. Their bodies are made to eat meat, animal protein, but cheap cat food has things like corn, wheat, and soy instead of meat. Plant protein is much harder for cats to use. When the cat's body tries to use plant protein, it makes lots of waste. The kidneys have to work extra hard to get rid of all this waste. This makes the kidneys very tired and sick. Good food with the right amount of meat protein helps the kidneys stay healthy. This lowers the chance of getting kidney sickness, especially for older cats. Most of the time, it's the cat owners who cause the problem without knowing it. Not watching how much water the cat drinks, giving bad food, and not going to the vet for checkups are the biggest mistakes. These mistakes can kill your cat. Once the sickness starts, these mistakes cost lots of money. Medicine for cats with kidney sickness costs a lot and is needed forever. The medicine doesn't fix the kidneys. It only slows down the sickness and helps the cat feel a little better. The only right way is to stop the sickness before it starts. Going to the vet, giving enough water, and good food are easy ways to keep your cat healthy. How do you know your cat is sick? The tricky thing about kidney sickness is that you can't see it early on. As long as some of the kidneys still work, the cat's body can pretend everything is okay. You might not know anything is wrong. The first big signs only show up after more than half of the kidneys are already broken, like 65% to 70%. Here are the main signs to watch for. Your cat gets skinny even though it eats the same amount of food. Your cat gets very, very thirsty and drinks lots of water, but its body still loses water. Your cat doesn't want to eat or eats very little. Your cat's fur looks dull and feels rough. Your cat's gums look white instead of pink. This means the cat doesn't have enough blood. Your cat throws up food, especially in the morning. Your cat can't poop easily. Your cat feels tired, has weak muscles, and doesn't want to play. Your cat has mouth problems like sore gums, mouth sores, and very bad breath that smells terrible. This is not just uncomfortable, it's dangerous. Bad germs from the mouth get into the blood and make the kidneys work even harder. This is why cleaning your cat's teeth is very important if your cat has kidney sickness. How to find kidney sickness early. Sadly, most people don't take their pets to the vet every year. Most people don't even go to the doctor themselves until they feel very sick. But going to the vet for checkups helps catch sickness early when you can still help. It's very important to get tests often. A blood test shows how healthy the cat is overall. It shows if there are problems with the blood. A special blood test shows how the body's parts are working. The vet looks at special numbers that tell them how healthy the kidneys are. The cat can't eat for 8 to 12 hours before this test. A pee test shows how thick the pee is and if there are bad things in it, like germs or crystals. Another pee test checks if there's too much protein. A germ test finds exactly what bug is causing an infection, so the vet can give the right medicine. The SDMA test is the newest and best way to check. SDMA is a sign that shows kidney damage. It goes up before other signs show up, so it can find kidney sickness before you can see any problems. A kidney ultrasound is like taking a picture of the inside of the cat. It shows what the kidneys look like, and if there are problems, it's also important to check the cat's blood pressure, because high blood pressure often comes with kidney problems and makes them worse. How to help a cat with kidney sickness. You can't cure kidney sickness completely, but that doesn't mean it's the end. If you find it early and take good care of your cat, you can control the sickness and give your cat a long and happy life. There's no magic cure that works for every cat. Treatment usually includes several things: special food that is easier on the kidneys, medicine to help the cat feel better and control protein in the pee, support medicine that helps the body stay stable and slows down the sickness. The most important thing for cat owners to know is that with the right care, a cat with kidney sickness can live a long time and feel good. What to feed a sick cat. Food is very, very important for a cat with kidney sickness. The right food helps lower how hard the kidneys have to work and slows down the sickness. Wet food with protein that's easy to use, like chicken or rabbit, is usually better than dry food. It has more water, which is very important because cats with sick kidneys often don't drink enough. The extra water helps get rid of bad stuff in the blood and helps the body. But if your cat won't eat wet food or you can't feed it often, good dry food from the vet can also work. The most important thing is that your cat always has fresh water. These special foods are made for sick kidneys. They have protein that's very good for the cat's body and less of things that make the kidneys work harder. But remember, too little protein is just as bad as too much. If there's too little, the cat will lose muscle, feel weak, and won't want to play. If you make your cat's food at home, the food should have a good amount of high quality, easy to use protein. Chicken, turkey, or rabbit are good choices. You should also add things with special healthy oils and vitamins that get lost when the cat pees a lot. There are some foods you should never give a cat with kidney disease. Don't give liver, fatty fish, or bone broth. They have too much of things that make the sickness worse. If your cat still has too much of these things, even with the right diet, the vet might give special medicine. This medicine stops the body from taking in bad stuff from food and helps control the sickness. But these medicines are only used when needed, and the vet watches carefully. What you can do right now. So, what can you do right now to lower the chance of kidney sickness in your cat? It's not hard, but these steps are simple and very important. Give your cat enough water. Your cat should always have clean, fresh water, and you should watch how much it drinks. Feed your cat well. The food should be good, with focus on easy-to-use animal protein. It's better to choose wet food, which already has more water, or well-made homemade food. Go to the vet for checkups. Starting when your cat is about 7 years old, it should get checked at least once a year. Blood and pee tests help you see the first signs of kidney problems before you can see them on the outside. This means you can help early and slow down the sickness. If this video helped you, please give us a like and subscribe to the Possum Frenzy channel so you don't miss new videos. Also, watch our next video where we talk about cat behavior so you can understand your furry friend